Hello there, private practice owners. This is Lisa Wozniak with Woz Marketing, sharing another episode with you of Private Practice Owners of the Month. And this month, we're celebrating Ray Barrett. Ray has extensively provided telemental health counseling services in private practice for facilities and for an EAP program. Both as a practitioner and a trainer, he aims to fulfill the knowledge gaps that exist for immediate implementation. Ray has developed several courses on telemental health and ensures his courses are updated.
When I first started my private practice, my very first client that wanted services from me wanted phone sessions. So his wife found me on the internet. She thought I'd be a good fit for him. And this person was a salesperson on the road a lot and used to being on the phone with people all day. So for him, it was a total fit. And actually for me, it was really a fit too, because I was already doing executive coaching, and the coaching that I was doing was all over the phone. So sometimes I'd meet with a client once or twice in the beginning, but very often not ever. It was usually just over the phone. So I was very used to doing that in my coaching practice. And I liked being able to work from home. I liked the convenience of it. I was living in Atlanta, Georgia at the time, and the traffic back then was horrible, and now it's even worse. So, even though there's a lot of clinicians around you, if you want to go see the clinician that you want to go see that's a fit for you, you're still having to fight that traffic, which is really a headache. It's annoying. It's very hard to fit it into your schedule. So I was excited to do that. So I said, yeah, sure, we can do that, not knowing how to do it when I took the call. So I had to scramble, because in graduate school, I didn't learn anything about working with clients remotely. I learned how to set up my office, have them come to my office, make sure I'm at the same height, have the same chairs that are at the same height, have them register in my office. I didn't learn anything about it, which is really weird because people have been doing it forever. And I found that there was really the knowledge was kind of lacking out there. And, but as I started beginning to provide that, an EAP program in town found out that I was providing telemental health services, and they wanted to provide it for their client. They had a huge chain of gas stations as their client, really spread out. And it's all young people that work at gas stations. Even the managers are young. And pretty traumatic stuff happens at night at gas stations, unfortunately. And they're not going to go see a counselor or anything like that. But if they don't, they might get really kind of stressed out from the traumatic experience, not show up to work, all that kind of stuff. So we would reach them where they are, which is their phone. Everybody has a phone, right? So I just call them and do a debriefing triage. It overcame the barrier to access tremendously. And then I would also do coaching calls for them. I'd coach 11 managers at a time from the different branches. And I think just the way the use of technology was going, I knew that this was going to be something that was going to grab hold. So I just continue using it. And then I was also doing mobile assessment. Mobile assessment, clinicians listening, some of you might be doing mobile assessment. That's where you drive typically from location to location, providing a mental health assessment or substance abuse assessment for hospitals, urgent care clinics, primary care physician offices. So I was doing that, but one of the hospitals in town in Atlanta, Georgia, decided that they were going to just do it through telehealth. So they hired me, and I provided assessments for this hospital in Atlanta, Georgia, while living in New York State for 3 years. They just wheel around a cart through the hospital. And what I found out was it was much more efficient. Rather than having to drive from place to place. There was so much time wasted and energy wasted not just simply dialing in and doing what we're doing now, Lisa, video conferencing. It
Sure.
didn't impact the quality whatsoever. It just made it much easier.
So how
So
did you get to the point where you started to teach it to other practitioners?
yeah, so so I realized that there was a real need in training. There was an organization that asked me to write up a small portion of a training for them. So I developed a training program, and then I've been training ever since. So my training is something I learned that I really enjoy doing, because I like being the expert in something, like really thoroughly knowing something. That's something about me. I don't like to dabble. When I get on something, I want to learn
You're all
every
in.
single thing possible about it. So, in which is what I do with telehealth. If there's like any question out there about telehealth, I'm like, oh yeah, and I try to find out the answer as much as possible. So I actually do much more training now than I do seeing clients. I cut way back on seeing clients, and but I
Good for
always
you.
want to be seeing clients.
Yeah.
And
So
my own practice is 100% telemental health.
what sorts of tools, Ray, did you use to measure your success? Like, how did you know you were headed in the right direction and, hey, this thing is working?
Yeah, well, it's like any business, I think, sales. So sales is the measuring stick in terms of, is this going to work or is this not? And then interest. Um, so are people looking into the services that I provide? Are they interested? Are they giving me a call? Are they asking me about it?
So, how would you say your practice is different as a result of this approach? I know you were saying that you had started to scale back on your practice a little bit.
Uh-huh. Yeah, so I would scale back more and more and more. So the way it worked is that was my I was protected a little bit with the risk because I had a private practice and I was seeing clients, and that was my business, right? That was the work that I did. So, so like if I'm seeing clients full time, and I would pull back on seeing clients, and then I'd pull back on seeing more clients as my training business grew. So as the training business grew, my private practice would dwindle, because I would, stop taking new clients. I'd stop marketing that because I wanted to invest more and more of my time and energy into the training. My goal is actually to see more clients. I want to start taking on more clients, and the way I'm doing that is by hiring people for my training business. So I recently hired a new executive coordinator who's going to be at a high level, handling all the administration. So I've had contract workers for several years.
What advice, Ray, would you give to a practitioner who sees a concept, whether that be telehealth or, I mean, it could be anything out there, sees a concept that's out there
Mhm.
and they want to embrace it and adapt that into their practice, but they're afraid?
So my number one thing would be to get a good mentor, and not just mentor, but mentors, right? Like more than one mentor, consultants, to find out, um, is there a market for this niche, for this field? What's the competition? And then doing it right by hiring people that could um, help you launch your product in the highest quality manner. hmm
So what's next in the growth of your business? What's next on your marketing journey?
Yeah. So I hope that I plan on us continuing to offer the highest quality continuing education, specifically in telemental health, and for my staff to handle all the administration, I'll be able to do new content creation, maybe at some point have another telehealth expert on board. That I've found difficult, because finding someone that really, really knows their stuff and does it does it full time. And then for myself to be having, say a 30% full-time, private practice, 30% of my time approximately doing private practice.
Absolutely. So with
Mhm.
that in mind, for practitioners who want to take that next step and they want to learn more about providing telehealth services, what's the best way for them to get a hold of you?
Right there, my website. It's telementalhealthtraining.com. Telementalhealthtraining.com. Yeah, so right through my website, that's one thing I really pride ourselves in, and very happy about, is we have awesome customer service. So if you call, you're going to get us, right? You're not going to get like a recording or something. You'll talk to one of us. You'll easily be able to be directed to me if you ever need to talk to me specifically and get questions answered. But in terms of training, it really is important to take a comprehensive training. So we have a telemental health training certificate, which verifies that clinicians have received a comprehensive training program in telemental health. And the reason why that's important is you want all pieces of the puzzle. So you need to know the laws, the ethics, how to select the right technology, the clinical skills, emergency management planning, screening for fit. All those competencies, they're essential. They're essential, meaning you need to know them, right? You can't have one piece of the puzzle missing. So I would take the certificate program. It's a great training program, and it'll provide you all the essentials, and then the clinician will be able to assess their competence. So that's the thing with assessing one's competence. You have to be exposed to what competence means first, and then be able to assess your competence. So they might say, you know what, I need to learn a little bit more about this or that. They'll be able to know that, be aware of it after taking, the certificate program.
Ray, we sure do appreciate your time with us today.
Yes.
Folks, this is Ray Barrett of telementalhealthtraining.com, teaching telemental health services to private practice owners. So thank you for being with us today and allowing us to celebrate you as our private practice owner of the month.
Thank you, Lisa.
So, folks, this is Lisa Wozniak with Woz Marketing, helping you navigate your yellow brick road. Have a great day, everybody.